The hidden dangers of smoking and vaping. During pregnancy, what every mother in the US and Canada needs to know. Smoking and vaping during pregnancy remain some of the most dangerous, yet completely preventable, causes of pregnancy complications, birth defects, and long-term health problems for a baby. While smoking rates among pregnant women in the United States and Canada have decreased over the past few decades, thousands still smoke or use e-cigarettes, often believing that vaping is a safer alternative. The truth is, both smoking and vaping can harm your baby in ways that may last a lifetime. When a pregnant woman smokes a traditional cigarette, more than 4,000 harmful chemicals enter her body, including nicotine, carbon monoxide, heavy metals, and cancer-causing substances. These toxins easily cross the placenta, enter the baby's bloodstream, and interfere with the development of organs, the brain, and the respiratory system. Nicotine narrows blood vessels, including those in the placenta and umbilical cord, reducing the amount of oxygen and nutrients reaching the baby. Carbon monoxide attaches to red blood cells in place of oxygen, cutting off an already limited oxygen supply. Many people assume that vaping is a safer option during pregnancy, but research shows that e-cigarette vapor contains nicotine, formaldehyde, acetaldehyde, lead, tin, and other heavy metals, along with fine particles that can penetrate deep into the lungs. Even nicotine-free vape liquids often contain harmful chemicals and flavoring agents that produce toxic compounds when heated. These substances enter the mother's bloodstream and reach the developing fetus, potentially affecting brain development, lung formation, and the baby's overall growth. The harm begins in the earliest weeks of pregnancy, even before many women know they are pregnant. This is when the baby's major organs are forming, and exposure to toxins can cause irreversible changes. Smoking or vaping during the first trimester increases the risk of miscarriage, ectopic pregnancy, and birth defects such as cleft lip, cleft palate, heart malformations, and impaired nervous system development. During the second trimester, the baby is growing rapidly, but nicotine and other toxic chemicals slow this growth. Babies exposed to tobacco smoke or vape aerosol in the womb are more likely to experience intrauterine growth restriction, meaning they are smaller and weaker at birth. Limited oxygen and nutrients affect the development of the brain, muscles, and bones, and increase the risk of preterm birth. In the third trimester, the dangers are even greater. Smoking or vaping late in pregnancy increases the chances of serious complications, such as placental abruption, where the placenta separates from the uterus before delivery, or placenta previa, where the placenta covers the cervix. Both conditions can cause severe bleeding and threaten the lives of both mother and baby. In addition, toxic exposure to the fetal lungs in the final months often results in underdeveloped airways, making it difficult for the baby to breathe after birth. The long-term consequences of smoking and vaping during pregnancy can last a lifetime. Children born to mothers who smoked or vaped while pregnant are more likely to suffer from asthma, chronic respiratory illnesses, frequent infections, learning difficulties, and problems with attention and behavior. The risk of sudden infant death syndrome, or SIDS, is also significantly higher. Studies show that nicotine exposure in the womb can change how the brain works, affecting emotional regulation, memory, and learning abilities for years to come. It's important to understand that the dangers of vaping are not limited to nicotine alone. Even nicotine-free vape liquids can contain flavorings and chemical additives that become toxic when inhaled. Some of these substances can damage DNA and disrupt cell formation in the developing baby. The lack of strong odor in vape aerosol can make it seem less harmful, but the invisible chemicals it carries are just as dangerous. In both the United States and Canada, health authorities, including the Centers for Disease Control and Prevention, CDC, and the Public Health Agency of Canada, strongly recommend complete avoidance of smoking and vaping during pregnancy. Cutting down the number of cigarettes or reducing vaping sessions is not enough. Any exposure to nicotine and toxic chemicals can harm your baby's development. The good news is that quitting smoking or vaping at any point during pregnancy can improve your baby's health. Within 20 minutes of quitting, your heart rate and blood pressure begin to drop. Within 12 hours, carbon monoxide levels in your blood return to normal. Over the following weeks, blood circulation improves and more oxygen reaches your baby. Quitting before the third trimester can greatly reduce the risk of low birth weight and other complications. If you're pregnant and smoke or vape, help is available. In both the US and Canada, free quit lines, counseling services, and support groups are designed specifically for pregnant women. Your healthcare provider can recommend safe quitting methods, such as nicotine replacement therapy under medical supervision, behavioral support, and online programs tailored to expectant mothers. Every cigarette or vape session you avoid gives your baby a better chance at a healthy start in life. Your baby relies entirely on you for oxygen and nutrients, and only you can protect them from harmful toxins. Quitting smoking and vaping is one of the most powerful gifts you can give your child. A gift that can protect their health not just at birth, but for the rest of their life.